Hi, I'm Eric Mansfield. I'm a licensed clinical social worker, and welcome to my channel, Practical Mental Health. So today I want to talk about ending the stigma of mental health. So just to kind of give you the textbook definition of stigma, it's a mark of disgrace associated with a particular circumstance, quality, or person. So what really sticks out for me on that is a mark of disgrace. So I guess the question is, why would anybody be disgraced for mental health, or if somebody's struggling with regards to mental health? In some ways, if somebody is struggling with mental health, whether it could be considered a sickness or an illness or a disorder or whatever it might be, think of your physical health. If you get sick, are you being disgraced because you have a cold? A cold can be resolved. Most mental health disorders and issues can be resolved. If you break a bone, are you disgraced by others for breaking a bone? If you end up with some other illness, whether it's cancer or whether it's diabetes or whether it's any number of things, you can run off the list. And are other people disgracing you for that? I would say probably not. There's a lot of people who empathize and would hope that you would get better soon. So the idea is, why are people being disgraced for mental health issues? So just something to think about. All right, so why does stigma happen? I mean, it could be any number of things. Culture or lack of culture. I think in the old days, when there was a tight-knit cultural community, usually people, when they had problems or issues, they had somebody to go to, usually their elders. They would seek guidance and help and assistance and direction. That's really no different than today. The only difference is people might be coming to a therapist if they don't have elders or anybody that they can trust to give them good information or good guidance. Some other things too, like labels. Stigma can actually occur as a result of like receiving diagnoses. Like I said, the majority of diagnoses are disorders, which means that they can be resolved in some way, shape, or form. Whether it's through therapy and being educated and learning how to manage and cope with emotions and thought patterns, or sometimes even medication management can be very helpful. Usually as a therapist, if I see improvement in clients who are actually working towards improvement, we'll mark it down as resolved. It's not the end all be all. And even though I might give a client a diagnosis, I mean, I tell them all the time, I don't want you to feel labeled. I'm not here to label anybody. As a therapist, I work off of symptoms, what's going on with the client, what are their immediate needs, as opposed to giving them that label that may be stigmatized. So other things might be fear-based. It could be the result of misinformation. People are afraid. It might be the kind of thing where there are a lot of assumptions that mental health problems means that you are dangerous, unstable, or incapable, and that's absolutely not true. The thing is, when we talk about culture as well, think about our modern culture. Think about the movies and all that. The one that comes to mind is Psycho. I mean, that is not the foundation of mental illness or mental health issues. None of the movies are. The idea is don't jump to conclusions based on your own personal assumptions. Don't stereotype people. Stereotyping, that leads to bias. It leads to judgments. It can be very detrimental to people who may be struggling. Another reason why stigma might happen, lack of education, lack of understanding. And that's what I'm hoping that this video is going to provide, is some education and understanding about mental health and why we need to stop stigmatizing it. So the stigma also leads to discrimination. And unfortunately, this can result in like reduced resources and support systems, not just through like government avenues. This can actually happen with regards to, well, yeah, even through government stuff. It reduced funding. That can actually take away resources that people actually will find useful and can be very helpful. You want people in society, hopefully everybody, to be stable and productive. If you leave people who don't feel stable, don't know what to do with it, don't know where they're going, don't know how to manage themselves, doesn't mean that they're dangerous or anything to that effect. It's just they may lack direction. They may lack the ability to cope from within. And then if you have people who are severely depressed, they are not going to be as functional. They may shut down. If you have people that are overly anxious, they may not be able to even force themselves to get out and participate in society. Those are just a couple of examples. So also, not only does it lead to discrimination, well, the other thing too is discrimination doesn't necessarily have to be on a government level. It can be on a societal level, like just everybody in general to some degree. I mean, not everybody, but even down to the family level. I mean, I have met a lot of people who have family members who actually tell them that if you go see a therapist, there is something wrong with you. Doesn't necessarily mean there's anything wrong. You may be just needing guidance, assistance, reassurance. It could be any, it's kind of hard to explain in a lot of ways with regards to how people might be feeling and what actually would bring them into therapy. Some people feel lost. I mean, they're just struggling. And on top of that, it does not help a person's mental health if they have family members telling them the wrong things. It increases stress, it increases anxiety, it increases depression, and it actually makes things worse as opposed to making things better. So this can also lead to self-stigma. That causes people to internalize the negative beliefs. And oftentimes, those negative beliefs are probably being fed to them by family members, the community at large. They may be getting it from movies, who knows where. This can lead to denial that a person who would benefit from assistance, it leads to denial that they feel like, okay, well, yeah, I don't need help. And so they continue going about their day in the struggle that they're in. It also leads to feelings of shame, low self-esteem, low self-worth. All this prevents people from actually seeking help that can benefit them. And as a reminder, so I may have just said this, but most mental health problems are disorders that can be resolved through therapy and or medication management. There's a certain balance. I think studies have shown that therapy can be very helpful. Medication management can be very helpful, but the two combined can be even more helpful. So the difference between disorder and mental illness, I think a lot of people tend to use those interchangeably, and unfortunately there's a lot of people that just see mental illness and that's it. But part of that stigma is that mental illness cannot be resolved, it can't be cured, or it can't be treated, or something to that effect. And it's unfortunate. There's a lot of people out there that think that if somebody is quote unquote mentally ill, they need to be put into a mental institution, and that is far from the truth. The mental institutions, as far as hospitals, in some ways can be helpful, and in other ways they can make people worse off. I'm not going to get into that right now. But the idea is that the difference between a disorder and a mental illness is really boils down to how pervasive are the symptoms and the impact on your ability to function day to day. So let's say depression, for instance, that can be a disorder. You might feel depressed. It may have some impact on your day-to-day activities, things that you might be doing, but you may get up feeling depressed. You may go to work. You may just feel down, but you're still functioning. So the idea is that would be on the level of a disorder. If you are so depressed and feeling those symptoms to the degree that you can't even force yourself to get out of bed, you're not able to get to work, you end up losing your job, you've been bouncing from job to job, then that could be classified as a mental illness. However, it doesn't mean that it can't be resolved. All of it, I think, can be. And then at the same time, it kind of boils down also to whether or not it's potentially biological. Is it a mental disorder or a mental illness that perhaps has been passed down from generation to generation? So for instance, schizophrenia, that is one that I have had clients, and I have clients with schizophrenia, and it is absolutely a struggle to deal with, especially if they are seeing things that nobody else sees or hearing voices that nobody else hears, trying to distinguish the difference between what is real and what is not real. To them, what they are seeing and hearing is absolutely 100% real, and it is a daily struggle to identify what is real and what isn't real, even to the point that some people are afraid to leave their own house because of it. So that definitely has a very intense impact on their ability to function in society. It doesn't mean that they're dangerous. In fact, I think that's part of the stigma too. Like, when it does come to schizophrenia, there's a lot of people that really think that this is a dangerous thing. Most people who have schizophrenia are not dangerous at all whatsoever. They're just trying to figure out what is going on inside of them. And quite frankly, most of them that I have seen and treated, it is just a flat out nightmare. Life is a nightmare to them, and I really feel for them. Also, the biological aspect. ADHD is biological, but that doesn't mean that ADHD is a mental illness. It can be managed. There are a lot of conditions that can be basically helped with medication. It can be helped with therapy, having the right strategies, coping skills, all that in place. It takes a lot more effort for some people than for others. But that's them. I mean, the idea is like, we need to be able to accept people for who they are and for what might be going on inside of them, instead of sitting around judging and ridiculing and putting down or criticizing or making people to feel less than simply because they have some issues going on inside their mind and their body. Okay, so in addition to that, so I kind of want to, in order to end the stigma of mental health, I came up with this idea. It's in a comparison, and I hope that this does help. So there are similarities between mental health and physical health. So think of physical health. If you want a healthy body, you have to feed it nutritious foods. If you want a strong body, you need to exercise. If you want endurance, you have to exercise for endurance. You have to exercise for strength. You have to make sure that your body's getting all the right nutrients, vitamins, minerals, You have to take care of your body if you want to be healthy. And part of the exercise is also when you practice, or excuse me, you have to practice in order to strengthen muscle memory. You have to practice in order to develop good habits and skills and stuff like that. So having said that, feeding your mind is basically sensory input. So what kind of nutrients, what kind of information? Is it healthy information that you're feeding your mind? What are you watching? What are you listening to? Is it healthy information rather than junk food for the mind? Healthy information basically is anything that's educational. It's hopefully useful information, something that you can utilize to your benefit, hopefully for the long run, as opposed to junk food, which would be, to some degree, video games. There are some studies that suggest that video games can actually help with problem solving, strategy, communication skills if you're doing it in a group. I think there are some colleges now that actually have like gaming leagues for that purpose. So video games aren't all bad, but at the same time, if you are sitting alone in your living room or bedroom or wherever playing Call of Duty or something like that for hours and hours and hours on end, and you're forgetting to actually live your life, then you're probably feeding your mind a lot of junk food. It feels good in the moment, but in the long run, it serves no actual benefit other than taking up time, if that's even a benefit. Okay, so as far as exercising your mind, you have to put into practice what you've learned. And oftentimes that comes about through visualization, meditation, problem solving. These are just a few examples. I'm going to do another video on feeding and exercising your mind and get really detailed with that. But back to the point of ending the stigma of mental health. The idea is that your mental health is really no different than your physical health. That's the way that I want you to view it. If you're taking care of your body, take care of your mind. I mean, even if you're not taking care of your body, please take care of your mind. Or not. It's up to you. It depends on how you want to do this. So therapy helps to educate, feed, and exercise people's minds, hopefully in a healthy and productive way. Therapy works, but you have to work at therapy in order to develop and practice good mental health. This is no different than your physical health. You have to get up, you have to exercise, you have to eat the right foods in the right amounts. Same thing with mental health. Therapists are educators, coaches, guides, kind of like a personal trainer at a gym. I wouldn't necessarily call myself a personal trainer for mental health, but basically that's kind of what I am. Therapy isn't just about talking about your issues. I mean, hopefully the idea is that, if you want to come to a therapy session and vent, I mean, that's your choice. That's perfectly fine if that is something that you find helpful. But at the same time, you should be building a toolbox of skills that you can take home with you. So in other words, you shouldn't have to have therapy for the rest of your life unless you want that. You should be able to build the skills, know how to use the tools, and then that way you can apply those on your own. It's kind of no different than school. I mean, you're going to go to school for a period of time. You're going to learn certain skills so that you can function in society, but ultimately in the end, you have to apply those tools, and pretty much you're on your own to function in society based on how you use those tools. So just kind of give you an idea too, most people come to therapy for guidance, for skills, for possibly, hopefully, I mean, well, not hopefully, sometimes for reassurance that, something isn't wrong with them. But that doesn't mean that there is something wrong with the person if they come to therapy. It's just a different set of skills. I mean, it's just, mental health should not be viewed any different than physical health. I cannot stress that enough. So, having said that, I would hope that people would stop stigmatizing people that have mental health issues. I would hope that people would stop stigmatizing people who come to therapy. Therapy is not a bad thing. It can be very useful and helpful for a lot of people. I actually would suggest that everybody attend therapy for a short period of time, try it out and see how you like it, see how it works for you. The problem there, though, is that every therapist is different. Everybody's trained in different modalities, different sets of modalities. So that could be a struggle for some people, is trying to find a therapist that is right for them. But nevertheless, I would appreciate and I would hope that people just stop judging and stop shaming people for coming to therapy. Are you going to judge and shame people because they're going to the gym? I mean, probably not. Are you going to judge and shame people because they're going to a doctor when they feel sick? Probably not. So why are you doing it for people that are coming to a mental health therapist? And I would also venture to say that, if you're listening to this video and you're very skeptical and very probably judgmental right now, and who knows what you might be saying to yourself even out loud, I would venture to say that every single person on this planet has a mental health issue that probably could be helped or resolved through therapy. At the very least, self-help. So, and that's what these videos are all about. I mean, I can only see so many clients a week. Doing videos allows me to be able to open up to the world, to provide a different perspective, to provide information from my point of view. Hopefully it resonates with you. But, I mean, what would be wrong with even watching a video coming from a therapist trying to provide good information, trying to help you feed your mind? Hopefully good information as opposed to junk food. Hopefully I can teach you how to exercise your mind through all the videos that I'm going to make, hopefully. And weirdly enough, making these videos has actually helped me feed and exercise my mind even further than I thought was ever possible. I mean, it keeps me on the ball with regards to my therapy practice. So, having said that, please stop the stigma. Please stop judging. Please stop shaming people. People who are struggling with their mental health are stressed out enough as it is. They don't need any more. So I'm going to end this video here. I hope you have a wonderful day. I wish for you a wonderful life. I love you all. It's a brotherly love. I don't care where you are, who you are. Take care of yourself.